David, you're muted.
Good morning, everyone. If you will just give us a couple more minutes, we want to be absolutely sure that the director of the Pan American Health Organization, Dr. Carissa Etienne, who was en route to the office, has indeed been able to arrive and get settled. So just give us a few more minutes and we'll be ready to start the event. Thank you so much. Good morning to all of you. Good morning, everyone. Thank you again for joining us to celebrate World Health Day, building a more just, equitable, and healthy world after COVID-19 in the region of the Americas. It's great to see all of you. It's far and wide, France, Bahamas, Argentina. But without further ado, because we have a packed agenda, it's my privilege to introduce the director of the Pan American Health Organization, Dr. Carissa Etienne. Dr. Etienne, over to you.
Thank you, Mary Lou. Honorable ministers and distinguished panelists, staff members, and all of you who have joined us today. Good morning and welcome to our World Health Day 2021 panel. This year, more than any other, it is highly relevant that we are focusing World Health Day on the urgency of achieving equity in health. The COVID-19 pandemic has certainly touched the lives of all, but it has not impacted us all equally. The unprecedented pandemic has brought existing social and economic inequalities to the fore, regrettably exacerbating them further. None of us want these enormous health inequities to be part of the future in our countries and certainly in our world and the lives of our people. Hence, the focus of today's panel is building a more just, equitable, and healthy world after COVID-19 in the region of the Americas. To build that future, though, we must first recognize and address the reality. People who live in the most adverse socioeconomic conditions have suffered the most from the COVID-19 pandemic. We know about the overcrowding housing, the need to go out to work every day, the limited access to water. These are very well documented social conditions that have plagued certain populations, placing them at a greater risk. People living in urban makeshift settlements, those working in the informal economy without social protection, and those living within institutional settings, our elders, people with disabilities, and imprisoned populations. They continue to be among the most affected. It is also our ethnic groups and migrants with long histories of structural discrimination that underlie their poor social conditions who have been hit the hardest. The reality is that these are the same people who already lacked access to quality health care and who had the poorest health status before the pandemic. Adding to the already huge informal workforce of around 50% in the region, the number of unemployed is steadily rising. Children of families who already lived in situations of vulnerability are more likely to fall behind in their learning goals, putting at risk an entire future generation and rolling back our social, economic, and health gains. I have said previously that action to control and treat COVID-19 during the pandemic, as well as during the economic recovery, must be centered on reducing inequalities. We must act decisively now to ensure the right of all members of the population to the highest attainable standard of health. On World Health Day, we are reminded that our region's policies should address the social and structural barriers to universal access to health and well-being, prioritizing populations at the greatest risk. We cannot and must not leave anyone behind. Our health system should be resilient, responsive, and adaptive. We must invest in primary health care and seize the opportunity to reposition health and the essential public health functions with a lens of inclusion and equity. We need to recognize that health inequities exist not only within, but also between countries. And a stark example of this is the gross inequitable access to vaccines that the world is suffering right now. Access to COVID-19 vaccines has become an imperative to rebuilding our societies that have been so struck by COVID-19. Once vaccines are available in countries, it is crucial to ensure their universal access. Vaccine distribution systems and communication campaigns must consider the barriers that can create inequalities in accessing vaccines, including the structure of our healthcare delivery systems, misinformation and infodemics, lack of transportation, but also important cultural differences that call for differentiated outreach strategies. An effective response for health for all will require the expansion of sustainable social protection systems, a living wage, acceptable working conditions, decent housing, as well as inclusive and strong education systems. We have the opportunity to transform our societies after this devastating pandemic. Of course, without a doubt, this represents a daunting challenge. Steering an equitable and sustainable recovery requires that we prioritize investments in the health and social sectors, but also work together with one common goal and a shared purpose, recognizing that we must all do our part. We need to do things differently than in the past. I remind my staff often of this. We must listen and listen better to and engage civil society and communities as partners for decision making, embracing their expertise and experiences in the development of recovery policies and actions that will impact them directly. Working to improve equity in health is one of the important priorities of the Pan American Health Organization, and the achievement of health equity is the centerpiece of PAHO's vision for a strong future for our region. Equity should be the force guiding recovery from COVID-19 in the Americas. And so, on this World Health Day, we are calling for commitment and actions that ensure health for all and address the social and economic conditions that keep people from living healthy lives. I am sure that the rich and diverse composition of today's panel will guide us by providing different perspectives on how to take advantage of this moment in which we find ourselves, moving the region ever closer to achieving equity and creating inclusive, resilient, and sustainable societies. Thank you for joining this discussion, and I look forward to listening to each of you. Thanks.
Thank you, Dr. Etienne. Again, welcome. Let's now turn to our panel conversation on building a more just, equitable, and healthy world post-COVID-19 in the region of the Americas in celebration of World Health Day. As the director said, our panel is very diverse and expert. We have distinguished civil servants, activists, and scholars to discuss how health equity has and can in the future shape our region as we rebuild and recover from this unprecedented pandemic. I'm very proud to have the opportunity to moderate this conversation. So let me introduce our panelists. Joining us today, we have the Honorable Carla Bisotti, Minister of Health of Argentina. Also, Therese Lord, member of the PAHO Youth Group and former CARICOM Youth Ambassador for Trinidad and Tobago. We have Tim Evans, Dean of the School of Population and Global Health, Mcgill University of Canada. We're joined by Carmen Cruz, Secretary General, Latin American and Caribbean Confederation of Domestic Workers. Gabrielle Muyuyi, Technical Secretary for the Fund for the Development of the Indigenous Peoples of Latin America, or FELAC. And Lois Pace, Director of the Office of Global Affairs, U.S. Department of Health and Human Services. This session is meant to be focused and a dynamic conversation. So my role is to pose just a couple of key questions to our panelists, and we hope that you enjoy hearing about their perspectives, their experiences, and their expertise. Again, it is a diverse panel, so we want to have the opportunity to listen and learn from their various vantage points. For this reason, I'm asking our panelists to also please limit the responses to about 3 minutes or so, and hopefully some of the responses will even enable us to build upon the conversation even further. So let's begin. As you know, PAHO has been closely following the data on infections, recovery, and general lockdowns in the countries of our region. And where disaggregated data is available, tracking the inequities. But there is a lot behind the numbers. So let me ask the panelists this first question. We have all learned a lot about health equity from the pandemic. What do we need to do differently or do more of to ensure access to health for all in the future? Let me please start with the Honorable Minister Bisotti. Minister Bisotti, if you would please lead us off.
Hola.
Hello, and a very good morning. It is a pleasure to participate in this meeting on World Health Day with such a prestigious panel. And on this topic, as we face this great challenge to the world, and particularly a challenge to our region of the Americas. Greetings to Director Carice Etienne and to each and every one of my fellow panelists. I also want to thank you for the invitation so that I can give you the Argentinian perspective. Without a doubt, the pandemic has placed the world and our region to the test, and not just the health sector, but also economic and social sectors. Our region has tremendous inequality, and our countries are working very hard to favor equitable access to health and services. And we know that for each inhabitant in our region to receive what they need, that is our goal. And we want to have egalitarian distribution and overcome these inequities. So it is extremely important to know that although we have a universal health system, letting the population have true access to health is still a pending challenge. So the government of President Alberto Fernandez, who took office on December 10th, 2019, in a country with an economic, social, and health crisis, has adopted health as a top priority, not only directly health, but also in terms of development and the economy. So our country, in pursuing this objective of fostering equity, has strengthened its health system and has incorporated 4,026 beds added to the ones that exist for adults, and 18 hospital beds per 1,000 population. So this is one of the highest ICU bed to population ratios in the world. And the public health sector went from 28% to 40%, and we've closed this gap with the private sector by working very strongly in this regard. We've expanded diagnostic capacity and worked with the subnational jurisdictions in this federal country in order to enhance our capacity to meet people's needs. We've built emergency modular hospitals, and we have expanded the supply of health care in strategic areas in terms of population density and also in terms of the social, economic, and epidemiological situation, with 864, almost 300 ICU beds, and the others are general hospital beds. We also worked with isolation areas for patients with lighter cases with additional beds. We also worked with the universities to have a list of volunteers that can also enhance the other critical point, which is a shortage of human resources and primary health care, contact tracing, and also in terms of science and technology, we have prioritize things. We are amongst the countries that are producing diagnostics, and also since we reformulated their various ministries, we've been producing face masks, and we've also produced respirators, and they've even been exported to other countries of the region to cover national demand. So in the context of this crisis, we have converted this into an opportunity to strengthen the population's access to health in the most equitable way possible. As our initial approach, that's just initial explanation of Argentina's approach to the crisis, and I now offer the floor to the other panelists.
Thank you, Minister. Thank you very much. Let me turn now to Ms. Lord, our youth ambassador. Terez, what have we learned? What could we do differently, or what could we do more of?
Thank you for your question. Firstly, I can think of few greater honors than the opportunity to deliver my perspective on the distinct occasion of World Health Day 2021. I think we've all gathered not to simply recognize the date, but to catalyze the movement of equity, justice, and a more healthy world, which is really at the nucleus of attaining Agenda 2030 in our region. Now, this traverses beyond the confines of this mere 24 hours of this day, this World Health Day, highlighting the disparities that exist in our territories, fixes our gaze on these issues as a means to act in collaboration and with deliberate action to address it. You know, we often hear conversations about the proclivity of social media to tell us a lot of things. And while it does portray a skewed reality of life in some respects, it is arguably a microcosm of the world in which we live and the situations in which we find ourselves and the situations that reflect what is true. So there has been a tremendous advancement as a consequence of economic growth, urbanization, and modernization. But as the paradox of the modernization theory provides, while a subset of society enjoys, experiences, lives, and laughs, there's another section that struggles to merely exist. So this conversation, it, like you rightfully said, is one that is relative to the creation of an enabling environment that predisposes all persons to something that is truly, truly basic. Equitable access to things that are truly rich and right in the world. In an early interview, Bob Marley was asked by an interviewer about his material possessions, ultimately, if he was rich. And he noted explicitly that his richness was life. So in as much as it is a cliche, it is now more of a fact than ever before, thanks to COVID-19, that your health is your wealth. So in the Caribbean and the Americas in particular, but at the world's level in general, a severe health injustice is served to our own selves when our health provisions allow some to advance and others to be left behind. So the COVID-19 pandemic has demonstrated that the socio-economic vulnerabilities are further exacerbated in times of turmoil. But the truth is that we did not need COVID-19 to tell us this any more than we needed it to be pointed out on a regular Tuesday morning. Equity gaps have been glaring and are glaring and will continue to be glaring and expand exponentially, but we cannot allow for that to happen. We attain health equity when an enabling environment is created for every person to attain his or her full health potential, and when no one is disadvantaged from achieving this potential because of social position or other socially determined circumstances. Therefore, if we take a good look at ourselves and realize that, say, a person with a disability is disadvantaged if he or she is unable to access public transportation in order to seek medical attention, or he or she is unable to walk from the bus stop to the hospital because of poor infrastructure, or he or she is even more disadvantaged because the hospital building is not at all wheelchair accessible, and furthermore, he or she is unable to be enrolled in school, much less attain gainful employment because of these aforementioned circumstances. Now, if this is the case, then a health disparity exists, emanating from his or her health status and the spillover consequences in terms of his or her ability to ultimately live a decent and dignified life.
Thank you very much, Ms. Lord. Thank you for reminding us about health is our wealth. Thank you. Let me turn now to Ms. Lois Pace. Lois, I believe you're with us, but we would very much like to hear from you about what do we need to do differently or even more of within the context of health equity and the COVID-19 pandemic.
Well, thanks very much, Lou, for having me, and greetings to your audience. Yes, I am in fact here. It's been a busy World Health Day for us here already, but I'm glad to be joining you all. And I can very much appreciate this question and the remarks that have been shared already. Obviously, as the last speaker said, we knew that health equity was a problem even before COVID-19, or I should say the lack of health equity. And so we knew this was a longstanding problem that needed to be addressed. And yet, unfortunately, it took this pandemic to remind us of that very truth. But I would say a few things about this. First of all, it's really naming it and claiming it as a problem. And this is something that you've heard our president do, and not just sort of tell, but try and show what the issues are. I mean, the trends, the data have spoken for themselves, unfortunately, given the disproportionate impact that COVID-19 has had on Black, Brown, and Indigenous populations in our country, let alone around the world. So that's something that we have been paying attention to, and this administration is very much aware of. It's one of the reasons why the president and vice president established a COVID-19 equity task force to address these issues, let alone call out racial equity as a core pillar of this administration alongside the importance of our domestic and even global COVID response. And so that naming it is important as a baseline, but again, we can't just talk about it. We have to be about it. We have to do something in response. And so that's why you see this task force and the head of that task force, Marcela Nunez-Smith, Dr. Nunez-Smith, as well as people who she's brought on board, looking closely at how, first of all, they continue to monitor the problem, right? You need to know what you're dealing with and truly measure the issues around equity to meaningfully address it. And we were finding that that was not altogether clear. We knew that the picture was bleak where we had that information, but in some cases, we didn't even have full information about the racial and ethnic or other disparities as they relate to COVID-19. And so it's really important, I think, for that task force and the communities they're trying to serve to look more closely at how COVID-19 is affecting certain populations, whether they be disabled groups, whether they be queer folks, whether they be other communities like tribal communities or U.S. territories, let alone at what we've seen with racial and ethnic minorities and marginalized populations. And then I think really working to do something with that data, specifically at the community level. And so there have been investments that the administration has made in those very communities, sort of leaning into their needs and ensuring that key resources are provided to increase testing, treatments, and even vaccinations in those communities, again, that are sort of suffering from those disparities or struggling with those inequities. And so it's an effort to close those gaps that we have identified. And then I think the final thing that I will say is to talk about the importance of cementing those lessons and those activities even beyond COVID-19. And this is where the importance of access to health comes into play. And this is, again, something this administration has spoken to, really acknowledging, as again, the previous speaker said, that it's more than just COVID, that we need to ensure that people can show up and be served when they do have health issues, because we know that this is something that is the case in maternal mortality, in chronic diseases, and a number of other conditions, health conditions and priorities that we all focus on. And so that's what I think can be done and should be done in terms of our lessons learned. And I'm really grateful to hear more from others what they propose as well. But thank you again for having us today.
Thank you, Lois. Let me now turn to Gabrielle. Mr. Muyuyi, what could we do differently to ensure access for all in the context of the pandemic? There you go. You're muted. Try, please.
Muchas gracias.
Thank you very much, and good morning, everyone. I would like to begin by thanking you for inviting me to this important event to commemorate World Health Day. My thanks to Pajo and Madam Director, to you for organizing this event. FILAC, as you know, is an international organization gathering the 22 countries in Iberoamerica. It's an equal organization with representation from indigenous peoples and governments. And in that framework, as a result of this COVID-19 pandemic, FILAC organized a regional indigenous peoples from Latin America and the Caribbean platform, PID, and together with indigenous peoples and interacting with their governments, through this platform, we were able to provide monitoring and following up on the impact of the COVID-19 pandemic on the indigenous populations. We drafted reports that were made available to the public, and currently we are working on figuring out what's happening with the vaccination campaign and the indigenous peoples. And in this regard, I would like to tell you that just like Pajo's Madam Director said in her introductory remarks, the impact has not been equal. The pandemic has hit the indigenous peoples particularly hard in our region of the Americas and in other parts of the world as well. And definitely, the indigenous peoples have shown their resilience and responsiveness to this great impact. Specifically, the rights who have a right to land and territory have been able to fight back stronger. The indigenous peoples that are able to interact with the public agencies were able to also implement actions appropriately to fight the pandemic in a better way. However, the indigenous peoples that do not have the right to land and territory have been hit much harder because food security, water quality, and environmental quality has been poor. Basically, the right to access to land and territory is key. And also the right to self-determination is key in order for our people to survive and to overcome these hardships. We have also seen that the indigenous peoples that are stronger in their cultural identity and values, their ancestral wisdom and traditional medicine practices were able to face the pandemic in a better way. Having said this, how could we do things differently? Well, definitely in the future, it is key to work with a differentiated approach and to have a comprehensive access to health for everyone. And that includes access to land and territory. Because if indigenous peoples have those rights, then they can truly enjoy those rights, and therefore they will be able to face adverse situations such as the one we're living now with the COVID-19 pandemic. So it is key that in our public policies and during the development phase to ensure that there is effective engagement of these different cultural representations, because in the region we have over 600 different indigenous peoples with their own view on spirituality, life, development, and health. Therefore,
we need to ensure the true engagement of all of these different peoples. And let me conclude by saying that in this current juncture, it is key to have a differentiated guarantee of access, and keyword being access to, and culturally appropriate implementation of policies and distribution of vaccines. It is of great concern to us as a result of the studies that we have done through this regional indigenous platform to see that there are still a lot of communities and peoples that have no access to vaccines. And when there is access, there is no differentiated and culturally appropriate approach. And this is key because it would not be appropriate to continue implementing actions that are contrary to our culture and values. So I would like to take this opportunity to urge us all to please work together with Madam Director and all of us to try to address all these topics, because this will be key for the future and for the present when we're dealing with vaccine access. There's a lot of inequality in vaccine distribution. There's a lot of anxiety around that, and there's also the need to ensure right to land and territory as well as to vaccines. So once again, thank you very much for this opportunity.
Thank you so much, Mr. Mayuya. You've given us some great ideas and very careful food for thought. Let me now turn to Dr. Tim Evans of Mcgill University. Tim, are you there?
Yes, thanks very much, Mary Lou, and thanks to my former colleague and big sister, Carissa, for your leadership, and happy World Health Day to everyone. I have three comments with respect to this first question. I think my first is that we're still learning and there's much more to learn. This pandemic is not over, unfortunately, and I think we still have a long way to go. We've seen that SARS-CoV-2 thrives on inequalities, racialized, indigenous, poor neighborhoods, the elderly, those with multimorbidity. But while it's been important to identify those inequalities, it's much more important to address them. And I'm afraid there's a huge action gap in effectively addressing those inequalities. I know in my own country, we identified inequalities emerging between racialized and white communities and poor and rich neighborhoods after the first wave in May and June of 2020. And when we measured these inequalities again towards the end of the second wave in January 2021, very concerningly, these inequalities had grown. And the rate of increase in infection in racialized and poor communities was somewhere between 2.5 and 3 times faster than communities that were better off. And it isn't that we didn't know about those inequalities, it is that we failed to act on that knowledge. And so I think we really have to look at how we can improve the efficiency and effectiveness of our action to address inequalities. Second, as somebody who's in an academic role now and leading an immunity task force, which is focusing on research, I've been impressed by the degree to which the knowledge function in public health is skewed away from the populations of greatest need. Let me give 3 examples. In long-term care, where Canada has been at the top of the league tables in the percentage of deaths amongst the elderly in long-term care, there's no research. There were no clinical trials because there's no capacity for research or clinical trials in those settings. In low-income neighborhoods, communities that put forward research proposals, those proposals were deemed not to meet scientific standards of rigor, and therefore they were not supported. and therefore there was no research with communities engaged in those neighborhoods. And third, in congregate work settings where people don't have the choice to work, there's no research looking at how their occupational settings can be informed and made safer as part of priority public health financing. So that knowledge function really needs to be made much more progressive. My last point is that we're lacking in public health a culture of emergency response with an equity lens. We have a one-size-fits-all approach, which may have been good back in the 20th century, but it's completely outmoded based on the nature and context and diversity that's found in all our societies. We see this manifested through one-size-fits-all testing systems that are centralized and slow, vaccine delivery systems that are facility-based and top-down, and most fundamentally, a failure to engage communities as a first priority rather than a last priority. So those are some of the things that I think where we still have a lot more to learn, and hopefully we can move in a much more progressive direction moving forward. Thank you very much.
Tim, thank you so much. Thank you. Let me turn now to Ms. Carmen Cruz, Secretary General of the Latin American and Caribbean Confederation of Domestic Workers. Welcome, Carmen. Please.
A very good morning to everyone. I am Maria Carmen Cruz. I wish to thank the WHO and everyone who has arranged this webinar. I represent domestic workers. We work in private homes, as we often say, and our federation is in Latin America and the Caribbean. For us, it is an honor to be able to participate in this webinar because although we might be working in people's homes for individual families, according to the governments of each country, we don't seem to be a priority. However, we are a priority because if we are taking care of older adults and children, and if we are in people's homes, as we say, you have to take care of the caregivers. If we take care of other people and are ourselves unprotected, we do need protection as domestic workers. What have we learned? We have learned that we need to keep fighting for our rights. This is something that we know is our right, and we cannot just let this go because, well, it's true that maybe as I'm commuting from home to my workplace, you never know what I might catch on the bus or the train or as I'm commuting. So we need to receive support, and we're very grateful that we do have an organization throughout Latin America, and we hope that throughout the whole world, not just in Latin America and the Caribbean. And we also meet with other international confederations of workers, and we face the same problem. So what I believe and what we discuss at our meetings and what we discuss amongst ourselves is that we as domestic workers also need to demand access to the vaccine as workers. And why is this so? Because we are an extension of the at-risk person because we go to homes in which there are at-risk people. So if older adults get vaccinated where I work, but I am not vaccinated, then you never know what might happen, what the risk might be to that senior citizen, if I'm unfortunate enough to contract this virus and take it into that home. So we do need this. We have learned that if we do not fight for our rights and get ourselves heard, then we will not be heard. We will not be taken into account. And we are part of the most vulnerable sector, but the least visible. But we continue to work on this so that our rights can be respected and we can enjoy the same rights as other people, even though each of us continues to work separately in individual homes. We are in touch with each other. We have learned that COVID has helped unite us more because I don't have to go to their homes to meet. We just had to learn to use these virtual platforms to be in touch, and we are in touch frequently and internationally as well. So that's my contribution today. And once again, I want to thank you on behalf of all of the domestic workers in Latin America and the Caribbean. And we do hope that we can also become a priority for receiving the vaccine. Many of us are still unprotected, and we're excluded from Social Security, although we have an agreement that has been ratified in many of our countries. But this convention is not taken into account. It's not complied with in many of our countries. In some countries, it's just halfway implemented. So we will continue fighting for our rights and see how we can mobilize to achieve our rights. Thank you very much.
Thank you, Ms. Cruz. So we learned a lot. Let me just do a couple of takeaways here from our panels, our expert panels. Carmen talked about the exclusion from Social Security and how domestic workers are essential to all of us. Dr. Evans talked about action gaps and research proposals and lacking, and also the lacking of a culture of emergency response with an equity lens. Gabrielle talked about the rights to land and territory and the need to focus on cultures and values of our indigenous populations. Ms. Pace talked about equity as a long-standing problem and how can we use the data for better action. Ms. Lord talked about the need to catalyze justice and to fix our gaze on deliberative action. And last but not least, Minister Bisotti spoke to us about how COVID-19 has put us to the test, that we need to have equitable access to our health services, and that we need to really depend on and expand our volunteers and our reach. Please join me in thanking all of our panelists for sharing their thoughts and ideas. We certainly hope that we as PAHO can continue to count on your expertise and your good vision and insight. Let me stop here and close this session and turn now to Ari and Manuel to show us a video in celebration of World Health Day. Following the video, we'll move immediately to Dr. Jarvis Barbosa, our Assistant Director, who will close the event for us. Over to you, Manuel. Thank you, panelists.
The COVID-19 pandemic has exposed and worsened the inequities that are barriers to health for far too many people in the Americas. Poor social conditions mean that certain groups are most impacted. Some of the most impacted are those working under precarious contracts and within the informal economy. They can't reduce their exposure to the virus by working from home. Migrants in low-paid, insecure employment and others living in crowded, substandard housing are also among those most at risk. They often have restricted access to water to wash their hands frequently or can't practice physical distancing. The COVID-19 pandemic has exposed and worsened the inequities that are barriers to health for far too many people in the Americas. Poor social conditions mean that certain groups are most impacted. Some of the most impacted are those working under precarious contracts and within the informal economy. They can't reduce their exposure to the virus by working from home. Migrants in low-paid, insecure employment and others living in crowded, substandard housing are also among those most at risk. They often have restricted access to water to wash their hands frequently or can't practice physical distancing. Long histories of structural discrimination often lie behind conditions of vulnerability. Afro-descendants and indigenous peoples are overrepresented among frontline workers.
Our apologies, a little technical problem. We'll try to fix it right away. Just a minute. David, I turn the host to you.
You know what? That's right. And what we can do is if we can just get the link following the meeting or event, we can get the link to our participants. Okay. So thank you all for trying though. It looks like a great video. And let me now turn it over to Dr. Barbosa. Jarvis, over to you, please, to close. Thank you.
Thank you, Lu. Thank you.
Para cerrar. Gracias, Lu, y gracias, señora directora. Y quiero felicitar a todos los panelistas.
Deliver to us. I think that it's very important, all these reflections, and from your perspective, what are the main messages that we need to take into account in this World Health Day. Let me switch to Spanish. Gostaria de subrayar a importância del trabalho conjunto.
I want to say this now in Spanish. I want to thank and congratulate the panelists for talking about the lessons we've learned from this. We've learned many lessons about improving equity in health, but we know that our measures are still insufficient. Equity is an issue that it concerns all the programs of our organization and go beyond the health sector. The fact is that equity should be the principle above all, but it should translate into concrete actions. We know that we cannot make progress towards equity unless we intervene or act on the social determinants of health. And this includes health systems and services. We have achieved substantial progress in monitoring inequalities in health and in strengthening skills and competencies in countries for the ability to provide disaggregated data and analysis. And above our joint efforts on maternal and infant mortality is part of our effort to leave no one behind in health. But these advances do not in and of themselves suffice. We have identified, understood, and been monitoring the mechanisms behind these inequities and the social determinants that are linked to them in order to adapt political interventions and to generate conditions that make it possible to bring about the changes that we need and to promote the implementation of new activities. After the lessons learned from the pandemic, we have been promoting the need to stress risks associated with social and economic determinants. It is for this reason that we are stressing that if you need to talk about a population in a situation of vulnerability, because these are the underlying conditions of both life and work that amplify risk to health and barriers to access to health services. The pandemic has enabled us to understand the structure of labor markets. Because of the large informal economy in most countries of Latin America, migration flows, and the conditions of neighborhoods and housing. Amongst other issues, we know that it is important to take all of this into account to have an adequate response. We have observed the expanded impact on certain groups in the region, such as the indigenous and Afro-descendant populations. Also, people in the informal workforce and their family members in precarious neighborhoods and precarious housing. And this has led to the creation of spaces for dialogue to listen to directly impacted communities. For example, meetings with indigenous and Afro-descendant populations that PAHO organized last year. Our PAHO is making efforts to have greater inclusivity and equity by implementing technical programs to ensure equitable access to health services by groups that have the greatest need and who have been most left behind. These efforts at inclusivity and equity occur, for example, to address vector-transmitted diseases and the right to treatment under cancer programs and initiatives to reduce maternal and child mortality and adolescent health programs and for HIV people and efforts of the tuberculosis program for the indigenous population and efforts to expand access to vaccinations, amongst many other things. But we need to assess this progress because we know that the results continue to be insufficient. Intersectoriality is also important and present in several initiatives and programs, and we include them in guidelines. But it's also important to make progress towards personalizing these effects and have monitoring and evaluation of the effects. We in the region are looking at the experience of case studies on the intersectoral approach and the lessons learned from the pandemic, which will allow us to strengthen our guidelines and include models of work in a more integrated, comprehensive approach that takes into account inequities beyond the pandemic. The tremendous effort being done in terms of achieving the Sustainable Development Goals has been taken up by states during the pandemic, but significant progress has been made in monitoring and disaggregation of data in order to have an equity approach in our analysis. At this time, we have an opportunity to change towards resilient and equitable health systems and to implement the basic health functions that include equity and the social determinants of health, intersectoral work, and the promotion of health in its functions, and that at the same time encourages social participation as an axis of work of the health systems. The COVID-19 pandemic has forced us as societies to look at health differently, in which disease and social inequalities are diseases that kill and make people sick. So it has become even more evident under this pandemic. We cannot make progress in health unless we address social inequities and unless we can achieve equity. We cannot achieve equity in health unless we address the economic and social conditions in which the population of our region lives and works. The diversity of today's panel reflects what we need to do to implement these solutions. Governments that are committed to equity and social justice. We need universities that are at the service of the current needs, with research being done, education and training, and advocacy, and organizations that represent groups and positions of vulnerability that participate in the search for solutions and demand timely response. We also must acknowledge the cultural diversity in the establishment of policies and interventions and the involvement of young people, senior citizens, and everyone to accelerate the pace of our response. We call you to bring together the various sectors in this tremendous and necessary task. We need only an entire society can do this. We can only be healthy if we are fair, just, without health inequities and without social injustice. Thank you very much.
Madam Director, would you like the last word to help close this?
No, simply to thank all of the panelists and all of those who've joined us for this morning, and to reiterate the message that, yes, this is a moment in time, but it's a moment when we must recommit in light of this pandemic, in light of what we've learned, to move forward with a certain level of urgency to ensure that all peoples have access to the health services they require, to have access to the social determinants, because there can be no sustainable development unless we do this. So let me thank all of you who are committed to the action for universal health. Thank you so much, everyone.
Thank you. Happy World Health Day.
The COVID-19 pandemic has exposed and worsened the inequities that are barriers to health for far too many people in the Americas. Poor social conditions mean that certain groups are most impacted. Some of the most impacted are those working under precarious contracts and within the informal economy. They can't reduce their exposure to the virus by working from home. Migrants in low-paid, insecure employment and others living in crowded, substandard housing are also among those most at risk. They often have restricted access to water to wash their hands frequently or can't practice physical distancing. Long histories of structural discrimination often lie behind conditions of vulnerability. Afro-descendants and indigenous peoples are overrepresented among frontline workers. People already living with inequities are more likely to suffer from underlying health conditions that make them susceptible to the most severe, life-threatening cases of COVID-19. Health sector policies need to establish and regulate equitable COVID-19 services and vaccination without discrimination. The health sector also needs to work with other sectors that manage housing, social protection, education, transportation, and especially the economy. Communities and individuals need to be aware of their right to health without discrimination. They should participate as equal partners to develop and implement solutions to the social and health inequities that impact them.
On World Health Day, we call for actions that break down all barriers to health for everyone, to ensure access to health without discrimination, and to repair the many conditions that are keeping people from living healthy lives. We must develop robust, non-discriminatory health systems as well as strong intersectoral collaboration mechanisms as we continue to contend with COVID-19 hotspots and to scale up delivery of vaccines. If we make equity an explicit goal of recovery, we have the opportunity to use this difficult time as a springboard towards achieving health for all in the Americas.